This Sunday is National Cancer Survivors Day. So many people wear that badge proudly, including Dr. Matthew Ramirez, a pediatric oncologist with Palm Beach Children's Hospital. Thank you so much. And we're going to get to your story in just a second. But for our parents, our grandparents out there that are watching, what are maybe some signs or symptoms that something's wrong, that maybe your child has cancer?
Sure. Well, first of all, thank you for having us.
You're welcome.
And unfortunately, cancer is one of those things that it can present in various ways. And so usually the way that we find patients, or that patients come to our location, is that something just doesn't sound right to mom and dad, or it's something that has been treated by their doctor and it didn't respond like it was supposed to. So it's these kind of things that kind of in the mind can pop up and say, you know, it seemed like it was pneumonia or something. Yeah, and it didn't seem like, you know, but it didn't respond like it was supposed to.
Most common children's cancers nowadays are?
So we still have the most common one is acute lymphoblastic leukemia. But as over time treatments have improved,
that's good.
That's now no longer our #1 killer. So so over many years, the survival rate has improved. So now that we're, for the most common type, well over 90% survive.
I've got to imagine you were diagnosed at 13 years old. That's kind of inspired you to go on to do what you do today. So if anybody knows and can convince children you can beat this, it's going to be okay, it's probably you. Tell me about what form of cancer you had.
So I had non-Hodgkin's lymphoma when I was 13.
What do you remember about that time?
So interestingly enough, it was about the time when I was trying to make decisions about high schools that I wanted to go to and what I wanted to be.
How tough.
And so it was actually the push that I needed to change that course into a future in medicine. And I had never been in a hospital. All of a sudden I was in a hospital for a very long time and got to meet doctors and nurses and see what they actually did.
We mentioned Sunday is National Cancer Survivors Day. What does that mean to you?
So, so we have Childhood Cancer Survivor Month is in September, and I'll probably be back for that one. But here, this is every cancer survivor. So breast cancer, prostate cancer, this is our month. All the survivors, whatever cancer you've had, this is the month to really,
a lot of warriors out there.
Exactly, to pat yourself on the back, we made it. But at Palm Beach Children's Hospital, again, our focus is on childhood cancer survivors. And so I run the Childhood Cancer Survivor Clinic for those patients who have been off of therapy at least 2 years. And we watch for the late effects. So all of the cancer therapies, whether it was for breast cancer, colon cancer, and our kids, all have a risk for having side effects later on in life.
Before we let you go, you also have an event coming up on Monday as well.
Oh, absolutely. I did want to mention. So we have a kind of kickoff for our childhood cancer survivors, kickoff to summer event at the Survivor Clinic, and it's occurring about 10 to noon, and I wanted to make sure I give you the number 561-840.
Okay.
6209, and that's where you can call and reserve a spot.
And where is this going to be?
So this is going to be at the Survivor Clinic at St. Mary's Medical Center, and so if they call to reserve, they'll tell them exactly directions to the clinic.
Perfect. All right, Dr. Ramirez, thank you so much. Congratulations, by the way. Thank you for the work that you do.
Thank you for having me.